We're here today at the Women's Healthcare Imaging Center here at Union on Morris Avenue, and I'm very glad to be here with Elli Pittas and with Dr. Seltzer. Elli, good morning, and Dr. Seltzer, good morning to you. Can you tell us a little bit about your background and experience, leading up to this project and this wonderful place you have here?
Sure. And my name is Elli Pittas. I'm the president and CEO of Women's Healthcare Imaging. I have about 30 years of experience in this field. I specialized in the development and management of diagnostic imaging centers. I thought over the years what a great idea it would be to develop a center of my own that specializes in these types of services, being that I've experienced firsthand of how difficult it is for women to get the treatment that they deserve. We created this experience to reduce the anxiety of women who are coming through for these types of services.
So that's really your mission here then,
That
is
is
to
my
make
mission.
it more comfortable
Right.
for women coming through to have to go through these tests, and having walked through your facility, I can see what a beautiful
Correct.
place this is.
Correct.
And how are you different than other radiology centers?
Well, we're dedicated to women's services,
Okay.
unlike some of your other commercial radiology centers who do everything from MRIs to
Right.
diagnostic services. We are a medical facility that specializes in medical technology in an environment that is very peaceful, very beautiful, very welcoming, that focuses on women's health and comfort.
I could just see by sitting in this lounge area here where some of your patients are waiting, and there's some food that they could eat, and refreshments and stuff, and it's completely different than I've ever seen it. I walked through and I met some of your staff. Tell us a little bit about your staff.
Okay. Our female technologists have at least 25 years of experience, if not more. They're highly trained, licensed, and very sensitive to the female patient's needs.
How long do you have to wait for an appointment here, and how does that work?
We have a same-day appointment availability. As a matter of fact, we receive calls throughout the day from our referring physicians. If they have emergency cases, we see the patients right away. For mammograms, patients don't have to wait 2 to 3 weeks or a month to get an appointment. They can have an appointment within 24 hours, if not the same day.
Okay.
The patient can choose to go to any center they feel is most comfortable to them, as long as it's within their geographical area. The only thing they need is a referral from their doctor, which is the script, which is the order from the doctor. And what they usually do is they call the different centers in the area to see if their insurance is participating with that particular facility. And if it is, they schedule their appointment. It's as simple as that. We have developed a fee schedule, and we have reduced cost for some of these services.
And I think, in the economy, I think that's really a great thing. It's really a reach out, especially to our community around here, trying to help people in this very terrible economy where people are losing their jobs and losing their insurance, and it's so important that we know to get mammograms and other things. And you offering some kind of relief to the cost, I think, is a credit to you and your organization here. How long have you been here at 1896 Morris? When did this facility actually open?
We've opened out in October of 2009, so we've been here a little bit over a year. And we have performed these services to a lot of women and have received a lot of positive responses.
Are people being more aware of what they have to do?
There's a lot more awareness out there. And I think Dr. Seltzer can build a little bit more on that, on medical director's point of view. But we are seeing women who, like I said, perhaps had a mammogram in their 40s, have had such bad experience that they didn't come back. They didn't go back to get their mammograms. And after they have spoken to people that had the pleasant experience here at Women's Healthcare Imaging, we see them returning for their continuous annual mammography, or their 6-month follow-up if the doctor, introduces that,
Right.
or their annual mammography.
Why did you pick Union? We're glad to have a facility like this here, but I'm just wondering why you picked us.
Well, we wanted every woman of every background to experience the Beverly Hills experience at Women's Healthcare Imaging. we have determined that women in this area do not have the accessibility to the type of boutique service that we offer. So we feel that every female patient, every woman, whether they're insured or uninsured, deserve a mammogram, and they should expect an excellent service.
Dr. Seltzer, let me just ask you a couple of questions.
Sure.
As, as medical director here, in your perspective, what makes this center different? Is it any, I know Elli's told us a lot, but in your perspective?
What we try to do here, which I've done at many other facilities, I've been doing this type of work for about 20 years, is that we want to treat the patients, as Elli was mentioning, with tremendous respect. Many places patients go and they're, as Elli said, they're anxious. They're having a mammogram, they're having a study that can be very anxiety producing, and they come and they don't really know, they have a study and they leave, and that's the end of it at other facilities. But here we really treat them, we really know how to make their visit as pleasant as possible. And then while they're here, we actually look at the studies. We work up the entire study. If they need other studies like an ultrasound, we do that as well. And then at the very end, we try to give them a result, either myself talking to them and give them a result, or talking to their physician, so that the bottom line is once they're done here, they know exactly what's going on. They don't have the anxiety of going home and having to worry and waiting for that phone call from their referring physician. They get an answer right when they're here, and we can do that. So that's what makes us different, is that we're giving immediate kind of care, and also the care coming directly from me. I can talk to the patient, where a lot of other radiology places, the radiologist rarely interacts with the patient. They usually just read it in a dark room, study, and send the report out to the doctor.
That's very comforting, because I know there's one of the complaints that a lot of people have about medical service today is the impersonal nature of it.
Correct.
I mean,
Correct.
and quick in and out, you feel like, you're not really getting to talk to people. And when you're talking about things like mammograms, which, involve breast cancer, I mean, that's extremely personal. It's extremely, people are very, like you say, apprehensive about it. And I think just being able to talk to the person who's really reading the thing, not reading off of some report with some crazy words in it somebody can't understand. So I really think that is a big plus in terms of what you're calling boutique type service. And be able to get the answer today, which I really think is
Right.
very good.
And many times the patients themselves, once you start talking to them, have other questions that they didn't really raise,
Absolutely.
just like in any doctor relationship, which they normally wouldn't be able to do in a typical mammogram setting. But my having to talk to them helps to foster that conversation.
Well, that's surely an absolute plus, I think, for this facility. Speaking about, women and their overall health, give me a little, feeling on that. In other words, it's how important it is for women to get mammograms.
Oh, absolutely, absolutely. Yeah, I mean, we're finding that, unfortunately, the incidence of breast cancer is fairly high. 1 in 8 women in their lifetime will get breast cancer. The good news is, though, that with the change in medicine in the last 10 years, the times that we're picking up early cancers and the treatments are so much better, that the outcomes, women are living a lot longer once we make the diagnosis. So coming in for yearly mammograms is so important to help women have better longevity and treatments for these things than they did many years ago. So it's really important that they don't forego their mammograms.
At what age are you saying that they should start an annual, or if you have family history? Tell us a little bit about on that.
Sure. With no family history, the first year they should come is at age 35. And then after age 40, it's every year thereafter. And that's been the guidelines for many, many years, both from the AMA, from the ACR. These are national medical societies that have put these things in place. People who have family histories, sometimes they will even start earlier than that, depending upon what the family history is, the age of the people in the family that had that. And we, tailor that depending on, what that history is.
I've looked at your equipment, and now we're digitizing everything is necessary, and I see these images blown up. Tell us how much better that is really than the film.
Oh, it's a remarkable, about 5 or 7 years ago when the technology came, it really revolutionized the field. Number one, the amount of radiation to the woman is almost half of what it used to be. That's tremendous. And also the quality of the images that we see, the resolution is so much better. We're able to pick up much smaller and much earlier cancers than we ever did before. So it's important not only to have state-of-the-art equipment for that reason so that we can pick up these cancers, but also to have the radiologist like myself who specializes in that field be able to pick it up earlier too, because of the training that I've had and others like me in this facility have had, so that we can, have a better chance.
I know some people don't get a chance to see it, but it's like, you're used to seeing the old films, but now you watch this on a digitized screen, you can blow it up real big, get a much better view of things. And I know in things like, when you talk about breast cancer, it's so important, to be able to see this at a much finite rate, to be able to give a better diagnostic or diagnosis of whether there is a problem, there isn't a problem. We've talked mostly about mammograms and how important they are and how you're a little bit different than other facilities. But I know you offer other services here. Tell us a little bit about those.
Sure, I'd be glad to. As I was mentioning, we also do ultrasounds, of course, of the breast as well for those mammograms that need that. But we also do general ultrasounds as well, everything from pelvic ultrasounds to abdominal ultrasounds, the whole gamut, including even vascular ultrasounds for any patients that need that. In addition, back to the mammograms, we also do, if patients have a mass, we can also do biopsies here right on site too. So we can really work up the whole aspect of a breast workup right here as well. In addition, we also do bone densitometry, which is a workup looking for osteoporosis. And we have actually, part of our DEXA machine is we offer the ability to look for vertebral fractures, something that's a little bit special to our machine than many other general machines that are out there. And then finally, we also offer just general x-rays, for those times that we need that.
Your bone density machine, you don't have to go into any type of tube or anything. It was sort of almost like open, right?
Right, right. In fact, it's almost no radiation. It's very, very new technology, which it's very quick and fast. The patient just lays simply on a table, and it's very easy.
So don't worry about if you're claustrophobic. It's okay. There's no tube.
Right.
Very good. As I see a list here, and it looks like, most insurance companies participate, but if they don't, just tell us a little bit again about what you would do.
We have a great list of insurances, most major insurance companies that we participate with. And the ones that we don't, that means the patient is going out of network.
Right.
It means we are out of network. And we have seen a lot of patients who prefer to come here because of the positive response that they've heard in the community. So we accept what the insurance pays us on their fee schedule, and we take care of the balance for the patient.
And I think that's very important for the audience who's
right.
watching this to understand. Everybody gets concerned about payments, and you're handling it like, I think most responsible organizations will. You're doing what you can, to help the people.
We all have a deductible, and we can't avoid that.
Right.
It is what it is based on each different insurance plan that we have. And we all have co-pays that we pay when we go to the doctors or whether we go to radiology, which is considered specialty. But we try to work with the patients even with that.
Right.
That's why, we went to all lengths to create a fee schedule that reduces that cost for patients without insurance. And, we're more than happy to answer any questions. If, people want to call in, we'll elaborate a little bit more with them on one-on-one. We are open 6 days a week. Monday through Thursday, we open from 8 a.m. to 8 p.m. Fridays and Saturdays, we're open from 8 a.m. to 5 p.m. We have extended evening hours, obviously, for the many moms that are working out there. Our telephone number is 908-964-0004. Our fax is 908-964-0034. And we have a website where it lists all of the services, any questions that the patients might have. They can visit our website, and that is www.womenshealthcareimaging.com.